All right. Yes. Thank you very much. So basically, as I said, we are going to speak a little bit about art, acceptance, and commitment therapy, because it's an approach that is having quite a lot of influence right now in the sports and elite sports. And there were some things in the training that you did that for me were quite interesting, and some of the matches and mismatches with other ways of working and trying to understand a little bit of the whole area of art. So first of all, Dr. Aura, if you can speak a little bit about yourself and what you do, and it will be helpful.
I always find this question really difficult. So I am, in essence, I'm an applied practitioner. So I have a history in research and academia, but nowadays I work full-time as an applied practitioner. I have my own private practice in which I see clients one-to-one throughout the week. And I use ACT quite a lot in my practice. So I've been working with a colleague of mine, Dr. Misha Jervis. We work a lot on this.
And as I have seen your profile, you have been working a lot you have experience with elite sports and within the sport world, but also in clinical practice, no, like clinical therapy with people. It works in the same way in each way of the environment.
Yeah, so I've worked a lot. I used to work in elite sport environments and exercise environments. I don't work directly in them anymore, but I work with people who exist in them. But not just sport, other kind of high performance environments. A lot of my clients come from high performance environments of various kind, whether it's like educational, business, sport, performing arts. Yes.
This is mostly the area that it calls more my attention, mostly because I have been working with some elite sports, mostly in fighting sports, boxing, but also I'm working for the NHS and I am coach inside of the NHS and I'm working with some management. And again, it's some kind of high performance and mostly how to deal with some kind of situations and feelings and scenarios. And it was this thing like, and as a manager myself of the NHS, that I have a team, 16 leaders and 100 people in my team, how to deal with specific situations and contexts, and how this approach can help to understand what is inside of the context and inside of the person in this context.
Yeah.
Does it make sense?
Yeah.
Perfect. So one of the first things I will be interested is art works inside of what is called contextualism. So can you explain a little bit what does it mean, the contextualism? What is that?
So there's ACT has a very specific philosophy. So it's more broadly, it's part of the pragmatist kind of paradigm. And without going too much into the philosophy, because I know that turns people off instantly, but it's like that means that they're really focused on how things function, the way that as a process. They're less interested in kind of making ontological statements about what exists, what doesn't exist. It's more epistemically contextual. And it's a specific kind of contextualism called functional contextualism, which was sort of founded, thought of by Stephen Hayes, the originator of ACT. And so functional contextualism, I'm gonna have to steal something or borrow it from Russ Harris, because I think the way that Russ Harris explains it is just very beautiful. It's like, imagine a chair with 3 legs, right? Yeah. Have you heard this example?
No, I have not heard this one.
Okay. So imagine a chair, you sit on the chair, one of the legs falls off, it has 3 legs. Is this chair broken? Is this chair damaged? Right? And so it's very easy from the kind of the traditional paradigm to go, well, this chair is a broken chair. Right? From the functional contextualist perspective, if you say, yes, this is a broken chair, you might have failed to take context into account, right? Because this chair can still be used for things. And if this were a workshop, I'd ask you what things the chair could be used for, but we're having a conversation. So it's like you could I don't know, use the chair to practice your balance. You could turn the chair upside down and hang your laundry on it. This chair is not irreparably damaged.
Yeah.
It's just in a specific context, it's not performing its function in the way you might originally assume.
So let's say, for example, if some person has a behavior that in a specific context is not useful or is not
helpful
in that moment, is not treating as a person as, oh, you have a problem. It's treating like, all right, in this context, this behavior that you are having is not helpful for you.
Yes.
It will be something like that.
Yes. That's more the approach you're taking. Whereas if you look at the kind of the traditional way that we view things, and I'm going to use CBT as a good counterpoint.
Yes. We are going to, yes.
Right. So it's like, if it's CBT, well, this is a broken chair. It's a maladaptive chair. It's a dysfunctional chair. Whereas ACT rejects all of that language, right? Everything depends on the context and the function.
Yeah. All right. Context and function. Yeah.
Yeah.
Very good. So in that respect, for example, let's say that a person that I have found this in several people who are in high performance, they are quite perfectionism. It's one of these things that I say, perfectionism. So this perfectionism, it has happened, for example, with some people who has stepped down in the role, like a sports athlete who is not competing anymore, but they still holding this perfectionism. So how to deal with that? Because suddenly it looks like this behavior is something bad. No, you have to stop this behavior. But it's the behavior that at the same time has helped the person to reach the standards that they need to reach for being a world champion. So what will you do with this kind of behavior?
Oh, how long have you got? I mean, I think for a start, we come back to like one of the second philosophical principles of ACT, which is from applied behavioral analysis, function over form, right? So we can get obsessed with the form. It looks like perfectionism. It must be bad. And we do know that perfectionism is not helpful, right? But we, like you say, we have to look at the function. This behavior, perfectionism, has been learned not as a solution. The perfectionism has been the solution to the problem for a very long time. It just so happens that now that they come to you, it's not working. It's not a solution that's helpful anymore. And so I think when you just take, it's like, this is not the problem. It's the solution to the problem. The perfectionism is the solution to the problem. And so we have to understand that what function this perfectionism is performing. It's this hypothetical case study. It might be that the perfectionism, if they do perfectionism, right, it means that they can avoid having to feel all of the vulnerable feelings that might show up if they're not doing perfectionism. It's a way of protecting yourself from that vulnerability. And
so it's understanding what is behind that specific behavior.
What is the function of the behavior?
What was the function?
Exactly. What's the function of the behavior? For me, perfectionism is often a protector, protecting you from more vulnerable experiences of what might happen or what you fear might happen if you don't do the behavior of perfectionism.
All right. So in that point of view, and in this area, and this is when the things get a little bit tricky. In ACT, you are very focusing what is behavior. So not so much focusing feelings and thinking, internal dialogue, anything like that.
Yeah, and this is where I have to really say that I'm an integrative practitioner. I don't do exclusively ACT. So you might hear me going into other modalities. So if you catch me doing that, tell me. I'm going to try and keep it as ACT focused as possible. Yeah, in ACT, you'd be looking at the behavior and modifying the behavior. The thoughts and the feelings are there to be acknowledged, for sure, but ACT as a modality doesn't overtly focus on kind of getting into the nuts and bolts of the unpacking and unpicking the thinking and the feeling. The idea is more acknowledge the thought. Is this thought helpful or harmful? If it's helpful, off we go, carry on. If it's not helpful, then maybe let's do another behavior that might be more helpful. And it's, about those kind of diffusion and unhooking skills when it comes to the thoughts and the feelings. So it's really influenced by kind of more Eastern philosophies in that sense, in terms of the mindfulness and the non-attachment.
Yes. So in that respect, because I have reading a little bit, this is just out of curiosity for me. From the act perspective, the thinking and the feeling is part of the behavior, or is not part of behavior?
So it's considered a private behavior. So we have in ACT, we have public behaviors and private behaviors. So thinking and feeling, it's almost like a radical behaviorism in a sense. It's like everything is behavior.
Yes. All right, perfect. And this is when the things start to be a little bit, as you see, with CBT, or for example, I have been not researching, but studying and looking a lot about imaginary training. So how to work with imaginary, how this a little bit start to be slightly different, because in imaginary training you have to work with the thinking process, with the image that you do yourself, with what you say to yourself, what you feel in that activity. So in this one is where there is a little bit of well, this is a different way of working. We don't work with this kind of images, listen in a dialogue, no feelings. It's different approach.
Yes, I mean, I can see how you might do that kind of thing from an ACT perspective. I don't think, that means that you can't then do imagery and self-talk. You're just doing them with a slightly different flavor. Yeah, you're coming at it from a different philosophy, right? It's like
yes, this is the thing. Yeah.
You go from CBT, self-talk means, we're trying to replace the unhelpful thoughts and all of this stuff. ACT is not doing that, but it might do self-talk, quote unquote self-talk, from a different perspective in terms of trying to cultivate different ways. It's possible.
It's different. Yes, all right. It's possible to work both together, despite the approach is slightly different. So, for example, one of the things, because I have been also watching in LinkedIn some of the people who I'm following from sports science, things like that, that they say the way that you talk to yourself affects the way you perform in the competition. But from ACT perspective, you don't. This is not work like that. You don't work with the way that you talk to yourself. You work just with the part that you behave externally. Is that correct?
Ish. It's like the way that you, again, it's a philosophical thing. When you come from a CBT perspective, you've already decided that there is nothing more important than thoughts, right? So CBT, thoughts have primacy, cognition has primacy, and it's seen as the most influential agent, right? This is a philosophical assumption. ACT is coming from the perspective of, actually, there is no additive benefit from delivering a cognitive intervention. So I think there was a study by Dobson and Kahari who said there was cognitive interventions in cognitive therapy do not provide any additional benefit, essentially. Which, so that's a massive shift. So we're basically coming into this as ACT practitioners going, thoughts aren't the most important thing. And so this idea that actually all of your performance hinges on what you happen to be thinking to yourself at the time is not, the idea is you can perform whatever your mind might be saying to you.
All right, perfect. Very good. I think that this part was important, because it's understanding this and checking other ways of working is good. There is a huge difference in here in the way of approaching the
the key thing, and this is Hayes writes about this, is that the belief here is that direct cognitive change is not necessary for improvement, is the idea behind that.
All right. Direct cognitive. All right, perfect. So there is not a cause effect in change the cognition, the inner dialogue and things like that with the performance.
In the ACT
from the ACT perspective, I understand
no additional benefit.
As much as I read about sports psychology, I can see that there are researches that says one thing, researches that say just the opposite thing, and at the end you sit and you say, all right, which one I feel is right for me? Because the researchers, they say sometimes different
both
things.
Of them are effective depending on which study. There is no research that conclusively even says that one modality is better than the other. We've got evidence to support a whole range of modalities. The only thing that consistently predicts success in the therapeutic relationship is your relationship between the client and the therapist. And so the most important thing is that your modality is congruent for you.
Yes, correct. Yes, very good. So I think this part is quite clear. Now is the part of the relational frame theory, so the part of the communication and the relationship with cognition. And I think in ACT there is a huge part in that, if I'm not wrong, that is about the work with the metaphors. It's where it slides in, no? The metaphor, the use of metaphors.
Yeah.
So how would you say metaphors is used in this approach, and which is the function of a metaphor? Because depending of the context of the approach, metaphors can be used for one thing or another.
Yeah, so ACT uses a lot of metaphors. Metaphors are really powerful ways of communicating, and also I think we have to acknowledge that our everyday language is filled with metaphors. We speak in metaphors all of the time, and obviously, as soon as I've made that statement, I'm finding it really hard to think of an average metaphor.
There is a lot of things. So I have been doing a lot of study of one of approach that is with metaphors. That is what they call autogenic metaphors. So it's the metaphors in our everyday. Like I hit a wall, for example,
Exactly.
or I am in a pit of despair, or I'm feeling that I have the weight of the world on my shoulders. So all of this kind of communication is metaphorical. But in the autogenic metaphor, basically what is done in this model, they try to extract the metaphor of the situation and work with that kind of metaphor. So in this, it's not the same to feel like I have the weight of the wall in my shoulders, that I feel I'm trying to go forward, I'm hitting a wall the whole time. Different kind of experience. So but this is the way that they
exactly. I think ACT takes advantage of this kind of metaphorical image-based, because it's images that we're dealing with, external sense impressions that we're dealing with, is a really universal language. And so with ACT, there are some metaphors that will be very commonly used because big names within the ACT world have come up with them. But you will still, as a practitioner, like if your client uses metaphorical language, I, for one, when I notice that, I take that and I run with it. It's like they've given me this metaphor, and now we can use the metaphor to kind of start shaping thinking. But there's something, and it's hard to put into words, you know, there's something about a metaphor that permits us to take perspective in a different way. And so,
from that perspective, then, because this is part of the things that I have been watching and things that I have to work a little bit with that one. So basically, you are taking the metaphors of the people and you are using that metaphors inside of the world. And do you memorize, because this is another part with metaphors, do you memorize, this kind of standard kind of metaphors inside of that? Do you memorize them and throw them as well as a part of the process?
Kind of. There are some metaphors that are well-known ones that I do know. You know, there's the chessboard metaphor. Love that. You know, there's the sushi train. That's a great one. Tug of war with a monster. That's a great one. I might not deliver them in the same way that I might tweak them just depending on who's in front of me. I usually will. But there are some metaphors that I've kind of just have at the back of my mind because they're just brilliant and they work.
And one of the things that I love of the training, the tweak that you do in the metaphors, because sometimes, and you say all this approach came a lot from the East philosophy, which I do agree, and the metaphors, in some way I say sometimes it looks too thin, and some people don't like this kind of thin approach of life, because in elite sports, sometimes the way of understanding the world has nothing to do with this. So basically, the way that you do the tweak in the metaphor can be useful in order not to look like too thin. Like, it's more natural, People receive the metaphor in a much natural way that it looks like you have, say, the kind of system metaphor. Does it make sense?
Yeah.
All right, perfect. That was very, very useful, because in this way is the relationship of the metaphor. Which is the impact do you think it does the metaphor into the patient or into the people?
So the metaphor for me is a vehicle for perspective taking. So in ACT, on the, you know, the hexaflex in ACT, that would be self as context, right? I think metaphors are quite helpful for self as context, a little bit of diffusion maybe. But they provide a different lens to look at the same situation through. And usually the client can take it to even, you know, other places after that. So it, you know, it is literally just there, I think, to just provide a different way of looking at it. And it's creating that little bit of movement, like a bit of flexibility within their system. And sometimes that's all that's needed to start creating just a bit more change. We just want to create the enemy, if there's an enemy, is fixity, is rigidity, right?
Yes.
And we want to create that flow.
And then is when these things that I love this term is the psychological flexibility. You know? So all in ACT at the end is to try to create some kind of psychological flexibility in the people.
Yes.
So in that way, there is two parts that I can see, and I will go a little bit through the hexaflex. I got it here as well. But there is two parts basically: acceptance and commitment. So basically, acceptance, and when I say, all right, is acceptance to what? Because in some ways, and this is one of the examples that I have been using quite a lot, and I'm trying to understand it. When an elite sports, they have a defeat, they lose. A boxer, they lose a fight. And we are speaking about maybe losing a world championship or losing a fight when a lot of sponsorship and a lot of things are behind it. Just not just a fight. It's basically a lot of things, things behind that. So when I try to think about acceptance, what do you have to accept? Once the defeat, it is what it is. You have lost for any reasons. Could be because your performance has not been good. Could be because the other person has performed better. Could be because referees has done a mistake. Could be a lot of things. Do you have to accept that? Do you have to accept your feelings and in that moment, because could be a lot of anger, frustration. You have to accept both of them. So look, the situation is what it is. We cannot change it, and your feelings are normal because you have a defeat, and you are going to feel frustration, sadness, thinking of giving up because it's not worthy. All the effort, all of this is normal in that situation. Is this what we have to do with in this casual scenario? Both of them?
Yeah, I mean, yes-ish. And I mean, one of the things that I say when I'm talking to people about acceptance is like, you don't have to like it, you don't have to want it, but can you allow it, right? It's like sometimes that's an easier step. And Russ Harris is a good model for acceptance. He gives it he calls it the 4 A's of acceptance. So acknowledge, allow, accommodate, appreciate. And appreciate's not always easy. You know, but it's this, well, acknowledge it. You know, there's no good comes from denial, generally speaking. Can you then allow this awareness, understanding to be here? Can you make space for it? And kind of experience your internal world and your external world without judgment and with compassion.
Here is part of the challenge, because they are not going to appreciate it. They hate losing.
Who likes losing?
No one likes it. But this is the thing. For them, it's like there is no possibility of losing. And when they have to face reality, when this situation you have lost, it's like when they have this kind of reaction that they hate it. So it's giving that space where, yes, it has happened. It is what it is in this kind of way. But sometimes it's the challenge, because it's like, and that will be the resistance in that. You are becoming too, how we say, you are conforming. Yes, you are just saying, no, this has happened. No, this will have happened. You know what I mean? They try to push back, like you are being too conformist with that.
Okay, as in like accepting the defeat means you're okay with it, kind of thing. Yeah.
Yes.
No, that doesn't have to. We don't have to equate the two, essentially.
Yes.
It's
Yes.
like losing is a fundamental part of sport.
Yes. Yeah. Yes.
And being, unless everyone gets participation medals, we can't all win, right? So it's like we have to, if you know, I have a history. I used to be an athlete many moons ago, but it's like losing is normal, natural part of it, and it has to be something that you learn to develop some acceptance around.
Yes.
Because if every time you lose, it is the end of the world, it's just it's not helpful. Is kind of the most the simplest
I
way
do
I can
agree.
put it.
Yeah, yes. I do agree totally. It's part of the thing because I'm working with right now with a couple of young athletes that they are quite good, and it's part of the learning process. Is that one, like in your career you are going to lose, and for me it's not very helpful. This kind of 30 winnings, 0 loses. Say that's not reality. Maybe 1 or 2, and you know it's.
I mean, unless you're Khabib Nurmagomedov, it's it's a very rare thing.
Yeah, this is the thing, but it's this part of being able to accept that, no, the acceptance. So it can with accept the situation in which you are right now. It's like what some of my mentors says a reality check. It is what it is. Sometimes we lose in sports, and at the same time is to accept the feelings that are in this specific situation, like frustration, sadness, thinking I'm going to give it up because I have been doing a lot of sacrifices and it has not been worthy. So all of this came in with it. So it's this kind of accepting both of these sides. All right.
Yeah.
All right.
And then a reframe that I've always found quite useful is you win or you learn.
Yes, yes. But also in this one, I have discovered that is the timing because some of my
don't do it too
boxers
early.
just when they go to the ring crying, frustrated, a friend, very good hair. Oh, you win or you learn, and it's like
I was like, nope, no,
not
now.
the timing, no good moment. Yeah,
let them
yes,
be with their feelings first.
Yes, this is it. Allowing like 2 or 3 days to like a weekend to deal with all of this. It's going to be frustration. It's going to be anger, sadness. You can cry. You can. And Monday we start to work with what next. And in this what next is when it comes the part of commitment. So commitment with what? What is with the values of the person. So how that works? The commitment with the value.
So the values are God. So values are a much bigger topic than ACT, to be completely honest. I think we could go back to the Greeks and talk about values, but within the context of ACT, values are basically the north point on your compass. It's like what kind of person do you want to be? What do you want to stand for? What do you want to represent? So, if you've got this athlete who's just lost a fight, and you've done the bit where you're doing contacting the present moment, acceptance, diffusion, all of this fun stuff with the feelings. They've got to the point where like, yes, you win or you learn. And then we go, okay, all right, values. So values would be like, well, in the face of this defeat, what do you want to represent? What kind of person do you want to be? When you look back on your career in 20 years' time, what do you want to be able to say about the way that you conducted yourself and the kind of person that you were? And it forces us to really think about, again, it's behavioral largely. Yes. It's like, how am I behaving? Am I behaving in line with the kind of person that I want to be and the kind of life that I want to create?
Yes.
And that can be a really powerful question, because then you go, okay, maybe you've just emerged from the pit of despair, and you're going in 10 years' time. And I look back on this moment, what would I want to, if I could see myself being videotaped, what would I want to see myself doing in this moment? And then you can extract from that goals. If you like to set a goal, you can bring goals into that afterwards.
All right. So this is very interesting. So here, values and goals. Values, as you say, is the compass, and yes, you agree. Mostly there is values in all the approaches that I have seen so far. So values is a big part, is the compass of the direction where you want to go. And that will, it reminds me a lot, also because my own processes inside of management and like performance in management, sometimes when you have different options, you have to sit and say, all right, which are my values and where I can connect with my values better in which of these options. And at the end, because sometimes you have good options in all the things, and you have, all right, what now? And you have to start to think about that. All right, which values I'm going to connect better. So that's very important. And the goals as well. I have found in elite sports that mostly they have a very strong working goals already. So when I work with them and I start to try to analyze, all right, they have goals. But one person that I thought, ooh, it struck me because it was a professional, but speaking about goals, it was not very clear. And I said, ooh, that's not normal. That's weird for me. Because usually they have very specific goals, time frame, realist, everything, the kind of a smart process of goals and the clear. So they have all this part they have worked quite well, but sometimes it's these connections. They have a lot in their mind, the goals. This connection, sometimes the goals with the values is what is missing. Like this kind of, yes, I have this and I feel this and I'm going to go for it, but whatever it happens.
Yeah. I think it's also important to remember that goal setting in ACT is a little bit different than in CBT. Right. So the SMART goals are different. We change the M and the A in ACT. So measurable becomes meaningful.
All right.
So the goal in ACT is only valuable if it's aligned with your values, right? So that's where we go for meaningful.
Yes.
And then
that's very interesting.
The A becomes, it goes from achievable to adaptive. So adaptive in that, does this goal take you in a direction that you want to go in? Will this lead you to the kind of life and the kind of person that you want to be? I think those two switches
makes a difference. Yes,
make a big difference.
I can see that because also speaking with goals, I have been trying, which is part of the process because goals to outcome, and sometimes I say, all right, let's go to try to switch a little bit goals in process, more increasing motivation, but sometimes it's different because it's outcomes. And I understand because the context of elite sports where there is a lot of things affected by that, but these little tweaks in that one could be quite interesting. It reminds me one of the things of goals, and this is sometimes is the difficult part of the meaning. It's in your nature, this goal. It's maybe the environment or yourself, because the environment has created about this specific situation.
I think that's a really good point. Sometimes, particularly because sport values conformity a lot, right? We value conformity hugely. And so, sometimes there can be some blending of the person's actual values and their actual values. Those are the things that will motivate them. Just like someone can't set a goal for you, someone can't set a value for you. You can't make me care about something I don't care about. And so sometimes it's a really interesting and fruitful conversation with clients to start to go, how do you think the context that you've lived in and worked in have influenced what you value? Do you actually, and really start to, there are lots of different exercises to access values. I like to use cards sometimes or checklists, or we just talk, but to start to really ask questions. Okay, why is this important? How is this important? Where does this come from? Do you think start to really unpack it? We run a workshop on ACT for teams and starting
I have seen it. Yeah,
of course, of course.
I have seen, this is very interesting. I have not been in this one yet, but I have seen it, and I thought,
sorry, I was like,
that's very well. No, I was in the focus, but I love it.
Suddenly, I was like, have I seen you in Teams?
I love that, but I have seen that you are doing the one for teams that as a manager, as I say, I work with 6 team leaders that are managers themselves and 100 people in there that they are managing in total. So basically, when it's ACT for teams, because all of these situations exactly the same, I found it in managing teams and performance and frustrations, and in the NHS there is a lot of that, a lot of you have to be resilient.
Yeah.
So this kind of stuff. So basically, it's like, yes, we have to use this as well in my own thoughts in teams and how to develop this in teams.
and it's not so straightforward, because I think most of the time what happens is that, 3% of the organization decides what the community, like the core goals are for an entire institution.
Yeah.
And then that's it. They put them on the wall and, whatever it is.
Yeah.
One of the things what I really like about our Act for Teams session is we look at different ways of going from the bottom up rather than just the top down when it comes to values. And I think that produces a lot more authenticity and congruence and buy-in.
Full understand. There is some things, not this hospital. I'm working in a mental health hospital in facilities, basically. I manage the facilities department. But I was working in another hospital, and I was in a time in acute medical unit, and it was with the pandemic and all of this situation, which was quite a difficult time. And they started to do a lot of things of resilience, because my natural inclination of liking this kind of stuff, I was doing the trainings and checking it and thinking about all of these things. And we were in the nurse staff room having a lunch, and one of the nurses said something that it was like, struck me in the face. It was, you know what? I'm fed up with all of this resilience thing. I want a little bit more management, so I don't have to develop so much resilience in this situation.
Ooh,
and for me, it was like, ooh. So this is the thing. We do all, resilience, yeah, let's go to build up resilience. But maybe it's not what they need. They need something else. Yes, resilience is good, but not having to get access so many times or so long to resilience, it would be better. And that was very interesting in teams. And if you work with the team, you will see that sometimes there is a mismatch about, right now in my trust, there is this kind of compassionate leadership. When you speak with the clinical staff, with matrons, things like that, and also myself, I can see that maybe compassionate leadership, they are good enough. So basically, they are very compassionate. They have been working as a matrons with mental health patients for a long time, so a lot of compassion in there. There is something different, but it comes this kind of compassion, and there is a mismatch in what the clinical staff and my staff thinks. People don't have to do compassionate leadership, and it comes from the top to the bottom. Sometimes it's like, maybe it's not.
Who knows? Though ACT also has strong feelings about compassion.
Yes, totally. So basically, and this is part of it. One thing is promoting the compassion, but other thing is compassionate the thing that is lacking in this team, or maybe it's a different thing.
Who knows?
So this one is part of the thing, is like resilience. Do we have to create resilience in the teams in the NHS? For sure. But they want more resilience. They want not to have to access so much to this resilience. So try to manage the things in different ways, so they don't have to be constantly acting over the resilience, the stress management, you know what I mean? So sometimes it's this. So we are very keen of implementing all of these things, and sometimes it's like they say, well, we have had quite a lot of this already. So this is part of the challenge that I have seen and saying, this is quite interesting. And I'm mindful about the time, because it's almost close. So basically, at the end, we have all of this, and how in ACT this is performed, of this kind of different approach about the contextualism, the metaphors, all of this is with the Exaflex at the end. So the Exaflex is this kind of tool in which there are 6 main areas, and these 6 main areas, there is a part of that I will see myself, this is quite a role related with acceptance, like the diffusion, community diffusion. There is another part that it is quite a lot with values. And can you explain me a little bit how do you work with this tool? What do you do?
So this is basically, I'll start by saying that ACT is not prescriptive, it's not linear, and there's no protocol, right? So it's very different. Again, it's different.
I love this one. Because one of the things in CBT, and I came from other area, that we work a lot in like a linear process. I am a process engineer, so from my point of view, that was like, oh, perfect, yeah, now I understand. Later on, reality struck me in the face and said, look, people is not linear.
There we go.
People that not even in a circle. No, yes, it's not linear. We do a cycle, I say, no, people is not psychers. We came from complexity. Now I'm taking a lot of complexity and I understand a lot better. I say, all right.
Complexity science is much more helpful for understanding
Yes.
human beings. Things like dynamical systems theories, you know, these are really useful ways to help it. And I think having something like the hexaflex, where the phrase is that you dance around the hexaflex. So it's like you can start anywhere and you can move to any point that you want based on what's in front of you. You know, so it might be that what's necessary is a little bit of, you know, someone's getting emotional, right? Starting to tear up. We might go into contacting the present moment, being with the feeling, making space for it. We might work on, it might be that they're feeling emotional because their mind has just said something really nasty to them. So we might do a little bit of diffusion. You can start anywhere and go anywhere. It really, so it's not as easy to learn in that sense, particularly if you're a beginner, because there's something comforting about a protocol, I think, when you're first starting out as a psychologist.
Yes. Sometimes, what I have seen in my own experience as a coach as well, sometimes we like to direct the practice in the way that is comfortable for the practitioner, for the coach, because we understand, sometimes I need to give a name to this process, but maybe this process has not a specific end or something like that. And we want to, like, 1, 2, 3, 4, close. Success for me as a coach. And sometimes we are too worried about that instead of being worried about, all right, let's go to see what is inside of my client and how they deal with all this situation.
It's like you have to be you as the practitioner have to be a lot more present, and in them you can't rely on the process or the protocol. You have to be there with the person, experiencing what's showing up and making choices about where you're going to take them, because there's so much more flexibility. You do have to make maybe more choice. This is a big statement because I'm not a CBT practitioner. Maybe a CBT practitioner might argue with me, but it's like there is no correct answer necessarily. There is,
in that point of view, because I like also this kind of approach, I'm every more and more like being very happy with this complexity approach. But if there is not a process, sometimes in the intervention, there is not a specific end that the practitioner says, all right, this is the end of the intervention. It's just that the patient say, or the client says, I'm happy, I'm right now in the way that I want to be, and I'm doing the things that I want to do, and that's it. There is no something that say, oh, let's go to do like a perfect ending, like a wrap it up for the whole process. Sometimes it doesn't happen like that.
It rarely happens like that.
I
mean, you usually set intentions or goals at the start of therapy, but that stuff can change, you know, as you go through this really dynamic, fluid, flexible process. Where you think you end up maybe has nothing to do with where you actually end up.
Yes. And this is also have a lot to do with expectations of the practitioner, a lot with that as well. That sometimes, also my own approach about how to learn all of this has to be like a sport. Sometimes as a practitioners, we have this kind of same time to improve ourselves, do a lot of trainings, and we generate this kind of expectations similar to an athlete that we want to perform so well and do that happy ending of the process and close up, that sometimes is more about my expectations than about what is happening inside of the person.
Which is why we all need supervision.
Yes. That's very good. So, and this with Hexaflex, we work with the values, with the committed actions, that I think is very interesting as well, and the diffusion. Just a little bit, because this. Can you explain for a everyday person what is this cognitive diffusion, or this diffusion of the? Because I associate this one with disassociation. So basically, from my own perspective, is I dissociate from the experience when I have been like in hell. Sometimes in my own life, that I have been emotionally in hell. So I am in the problem. So and the world around me is myself, the hell, the problem. And for me, this kind of cognitive diffusion, I can relate this a little bit, like step away from the problem. The problem is still in there, but you are going to see from a way perspective of it.
Yeah, I can totally see where you're coming from. There is a difference between cognitive diffusion and dissociation. Dissociation, from my perspective, is almost like a splitting from the experience.
Yeah.
And there's a somatic component to dissociation as well, in terms of it often comes with numbness and emptiness and all of that stuff.
All right, I know what you mean.
Yep, we've been there.
Yeah.
So cognitive diffusion is slightly different. It's not about splitting off from the thought, cutting it, you know, disappearing off. It's more about making space for thoughts that are uncomfortable or unworkable, right? We acknowledge that the thoughts are there. We don't think of a pink elephant. I dare you. Just do not think, do you know what I mean? They're there. You can't see, you've got very little control in that sense. So it's about becoming the observer of the thought. And this is where diffusion blends into self as context just a little bit. And so it's like, when we're doing diffusion techniques, we're trying to create an environment in which the literalness or the intensity of the thought is reduced by essentially going, here is me, and here is this language that my brain is shouting at me at the moment.
It will be, because I have been, and this all came from the Eastern culture, I've been doing yoga for a long time, for years, the training. And there is this kind of approach that I have seen as well in the Zen Buddhism of observe without any kind of judgment. You just observe, like in the way that I'm observing. I have furniture here. So I'm just observing, no good, no bad, it is what it is, just check it out. Observe. It will be this kind of approach, slightly.
That's more self as context, right?
Yeah.
So like but yes, essentially it's like you are not the content of the experience, you are the context in which they are emerging. You know, if you can observe it, you cannot be it, kind of thing.
All right,
right?
perfect.
That's self as context. And then diffusion is the kind of the act of just unsticking, unhooking, coming so that you can, here's you and here's your experience. And they're not the same thing. They're not blended anymore.
Yeah. All right. Perfect. I think this is very useful, mostly in the moment, because at the end, and as I say, in the moments in which I say metaphorically, you are in hell, is when these things must be really useful, because when the things are good, when you are winning, everything is perfect. In these moments is when all of this has to be useful. So it's this part that I thought, this is one of the core elements, because it's when you are in this hell of emotions and you have to work with that. Perfect.
Exactly. It's the difference between I am angry, right? I am angry. It's like you and the anger are the same thing.
Yeah.
And going, I notice that I'm feeling angry. Suddenly, there's all of this space.
Yes. I have seen that you are doing a lot of work with anger.
I do love working with anger, yes.
Yeah, we can do another session just with that, because this is a major issue. I have seen it a lot of it at the same mama.
You work with fighters though, right?
Yes.
I used to be a fighter, and so
Which kind?
So I started in ITF Taekwondo. I then moved into Muay Thai, and my greatest love was Brazilian Jiu-Jitsu.
Yes, very good. So my son is doing Taekwondo. I have been kickboxing Muay Thai for a long time, and BJJ as well.
Nice.
And I'm working with BJJ boxers, a lot of boxers, because I was in elite sports in kickboxing and boxing in Spain. And my coach has a lot of people who know.
There's a lot of anger in that community. And,
and there is two things in this one that I have found. One is anger, and another is what do you do with aggression. And I have been, what do you, because you need aggression for fighting.
It's necessary.
It's necessary. How do you frame in a way that in a specific context is good, some specific context not so good, and how to work with that is quite a challenge.
Yeah. I mean, I think consent is a huge thing, and I think when you're in a martial arts gym, right, everyone has consented to reonable aggression.
Yes. So, but this part are the key things that we can do one day speak about this one, like acting in fighting sports and things like that, and anger and aggression, because for me it's the big thing. It's the big thing, and I love it. So very good, BJJ, very nice, I have to say. I approach my learning of all of this as my practice in kickboxing or my practice in BJJ. So all the practice, all the learning, I'm doing the same kind of approach because I think it's been quite helpful.
It helped
Like
me too.
Yeah, very good. So thank you very much. Thank you very much for your time, and let's talk another day about all of this in the context of fighting sport.
Great.
All right. I'm going to stop the record.
Fantastic.